Hi everyone, it's me, Melanie, your IVF nurse, and I'm here again with Megan, a genetic counselor, and I'm clueless on this, but I know that some physicians or REIs are talking about carrier testing, and women, when they're choosing to become pregnant, should be having this. So I'm back with Megan to discuss why.
Great. So carrier screening is a genetic test that can be done on any prospective parents to see if they're at risk of having a child with a genetic disease that is usually not seen running in their family. So that's something that people are usually surprised with is, well, there's nothing in my family, so why would I bother doing a genetic test to see if I'm going to have a child with a genetic disease? My family's very healthy. About 80% of children that are born with genetic diseases don't have a family history, and it's because of the way our genes work and the way things are inherited. So anybody who is the type of person who wants to prepare as much as they can for the birth of a child or kind of know if they're at risk for these types of things is somebody who might be interested in carrier screening.
Is there any specific demographic that may be more prone to certain things? So if you're French Canadian?
Yeah, good question.
Right?
So there's a couple different groups that we used to recommend carrier screening to based on ethnicity. So people who are French Canadian or people who are Ashkenazi Jewish. But every ethnic background has certain things that they are at a higher risk for from a genetic perspective. So we've started offering carrier screening pan-ethnically to everybody. The one group that are particularly at a high risk of having children with these types of genetic diseases are people who are called consanguineous or who are related by blood. So anybody who's having a child with a cousin or a relative where they are related by blood is at a higher risk for things like this. And this is more common in certain cultures, so those individuals are at a higher risk for those type of things. Carrier screening looks for certain types of genetic diseases, but not everything.
Okay.
The way that it works is it's basically doing a spell check on some of your genes to see if there's any typos in them. We have 2 copies of most of our genes. We get one from our mom and one from our dad. And normally when our genes work properly, we're healthy. In these types of conditions that carrier screening is looking for, they're called recessive. And in these conditions, you can have 1 copy of your 2 genes not working and still be healthy. These people are called carriers. You're still healthy because one of the genes works properly and it kind of overcompensates for the one that isn't working. So carriers don't have any symptoms, they go about their lives not realizing that one of their genes isn't working. But if a carrier has a child with somebody who carries the same thing and the mother passes on the gene that doesn't work and the father passes on the gene that doesn't work, then the child will have no copies of the gene that works and the child will be affected by a genetic condition because they don't have any genes, any copies of that gene that are working. So both parents were healthy, but they had a gene not working and they both passed it on to a child. Now the child has no copies of the gene that are working and so they have the genetic condition. There were no signs in the family because everybody's been healthy, nobody had a child with a carrier of the same thing.
So with a situation as such, this is where you would do your carrier testing, and then if you're depending on what is found, if you're doing IVF, then you could actually do PGD to specifically isolate those embryos affected with whatever came back in the carrier testing to isolate those.
That's right, correct. We do genetic testing on the prospective parents first because the embryos are so small, we can't test them for everything we're testing the parents for. We really need to know exactly what we're looking for before we can do that genetic testing on the embryos. So we start by screening the parents, and then if there's any risk, then we can move on and screen the embryos, see which ones will have the genetic disease and which ones won't, and then only transfer the embryos that will be free of the disease.
Okay, so what are some of the common things or examples that I guess you have seen as a genetic counselor?
So different genetic testing laboratories can test for various different conditions, and your physician or genetic counselor can walk you through what type of information would be best for you. Some people prefer only to know about genetic diseases that are very severe and would really limit the quality of life of the child or would cause them to pass away very young and very early. There are panels of conditions that are small, and we can look at a limited number of things that kind of fit that category. Or we can look at a very large number of genes, sometimes hundreds, that include very severe things and other things as well. But people might consider a bit more mild. Common things that people are screened for are things like cystic fibrosis, which is a lung disease. It makes your lungs really sticky from birth. It makes it hard to kind of breathe if you get a lot of lung infections. People are living into their 40s with this disease now because of current medical advances, but you still need very regular physical therapy, and children do spend a lot of time in the hospital because of their frequent infections. Other conditions include spinal muscular atrophy, which is a muscle disorder. There's a couple different types, but most babies pass away around age 2 because it's hard for their muscles in their heart to work and hard for their lungs to work properly, and so they pass away very young. Other conditions are things that only affect boys. So there are things that women carry that they only pass on to their male children. People have sometimes heard of that. Things look like they're skipping a generation. That's often because women aren't affected, but men are. And there's a condition called Fragile X syndrome, which is a condition that is the most common cause of intellectual disability or problems with mental functioning in males. So those are some pretty common ones that carrier screening looks at, but as I said, it can screen for hundreds of things depending on what you're looking for.
And do patients that are about to do carrier screening, do they, like you've said, they only want to know what would be, I guess, extreme or fatal? But is there anything that, I guess, do they have any input on what specifically, like what goes on that rec for testing? Or is it just a general panel and then it's kind of left up to the doctor or the genetic counselor to go and say, okay, you only want to know the extreme, so these are the extreme?
It's usually a panel, and most labs have a couple different options, and there's kind of the really basic, the severe conditions, and all you can test. They will test. Different labs have different options, so some of them might let you pick and choose. I think for the most part, there's kind of preset panels that you can pick.
And there's no age limit, because I know a lot of the times, and I know what you're going to say, but I know a lot of times with IVF and when you're doing genetic testing, a lot of it is do genetic testing on your embryos because of your age.
Right.
With carrier screening?
Carrier screening is different. It's not at all related to reproductive age. It's something that anybody, whether they're doing IVF or going through a pregnancy naturally or doing an IUI, anybody who's planning on having a child can do carrier screening. And age is not a factor. It doesn't put you at an increased risk for these diseases. It's mostly based on your ethnic background and things like that that might put you at an increased risk. What really matters is if you and your partner are carriers for the same thing. You can carry different things and your child might not be at risk, except for those few conditions where it only matters if the woman carries them, and that's a different story. Most people carry something. It's estimated that on average people carry 3 to 5 different things, but again, it only matters if your partner carries the same thing.
How do we do the testing?
It depends on the laboratory. It can be either a blood sample, it is often a saliva sample. You spit into a tube and mail it off to the company. Results are usually pretty quick because some people do this once they're already pregnant and want results back, so it's usually within a month or so, but you would have to check with the specific lab. Once the report comes back, it's best if somebody like a genetic counselor or your doctor reviews it with you just to make sure that you understand everything and the implications either for yourself or for your future children. Other considerations is that sometimes we can learn something about the health of the intended parents by doing carrier screening. So the point is to learn if you're at risk of having a child with a genetic disease. But sometimes the spectrum of severity of genetic diseases can vary. So some people with a condition might be really mild and some people might be really severe. If there's a small chance by doing a genetic test on anybody, we could learn that they themselves actually have a genetic disease. That's not the point of the test. It is really to learn if you're at risk of having a child with the disease, but every once in a while we can learn something about your own health by doing the test. And if that's not something you would want to learn, it's potentially a reason why you might not want to go ahead with carrier screening. It is a genetic test. The point is to learn about the health of your future children, but things can happen incidentally, and if you wouldn't want to learn anything about your own health, it might be a reason not to go ahead. That being said, the purpose of it is not to learn about your own health, and so if it came back negative, it wouldn't be to say there's nothing genetic in your family, you're going to live a completely healthy life the rest of your life, because it would have just been incidental if we found.
Okay. Now, you had just used the word intended parent, so those of you who know me, I do a lot of third party. Now, if someone and I'm going to say yes, that if you have an intended mother who donates her own eggs for her own IVF cycle and the father, they should have screening if they're implanting into a surrogate.
That's a good point. It's the person who it's their eggs and their sperm is mostly who this is relevant for, who is considered the biological parents of the future child. The genetics of the surrogate or whoever is carrying the pregnancy would not be a factor for carrier screening. So whoever is carrying the pregnancy, unless it's also her eggs, doesn't need to be screened. But the person whose sperm it is and the person whose eggs it is is relevant there.
So that being said, if you have a client or a patient where, say, the husband has tested positive in his carrier screening for something, if they're looking at the route of using an egg donor, then the egg donor should be tested for anything that would be,
that's right,
that she would be a carrier for or test positive for.
And some agencies do regular genetic carrier screening on all of their donors and others don't. So you would need to find an agency that was going to be able to facilitate whatever you needed to accommodate that. Some people who already know they have genetic diseases or they are carriers choose to use a donor if their partner carries the same thing as a way to avoid having a child with a genetic disease instead of doing a genetic testing of embryos. So there's lots of options with donors available.
Anyway, thank you again for sharing your information with us. I hope you found this very helpful. Once again, if you have any questions, you can email me at yourivfnurse@gmail.com. You can follow me on Instagram at yourivfnurse. You can subscribe to my YouTube channel or comment down below. Thanks for watching.